welcome back to the show. My name is Ben Jones, your host, and I am super excited for the guest we have today. He's my personal physician. He is brilliant at what he does and someone that is truly making a huge impact in so many people's lives as being the medical director over Fit Body Boot Camp Arizona, and also for our Optimized Man coaching and testosterone optimization program. He's also the physician that is doing the blood work, hormone optimization, and I think as someone that's, just so you understand why I work with him, is that being a veteran and my testosterone being super low at the age of 22 after getting back from Iraq, found out that my testosterone levels were that of an 80-year-old man, which is also, as an FYI, for any veterans out there, they got deployed, this is a common thing. And after being just frustrated, trying all these different things, I started working with Dr. Neil Morris. And one of the things that he said to me is like, dude, I have a patient that has one nut that creates more testosterone than you do. And, anyways, this kind of began our journey of trying to figure this out, and some of the things that ultimately is what has led to the program, the Optimized Man coaching program. And, so that's why I'm super excited today for you get to hear from the man himself, Dr. Neil Morris. So welcome to the show. Super excited to have you. And, I think so everybody gets to really know you a bit more. Like, I'll turn it over to you and just, give everyone your story. Like, how did you get started in medicine, and just what was your background, and what was your journey that got you to this point?
So thank you for having me.
Absolutely.
I started in medicine, well, initially, like back when I was like in high school, I knew I wanted to do sports medicine or something like that. I was able to go to college and play college football. And I wanted to be sports medicine, but they wouldn't let me. They said you can't play football and be in the sports medicine program, so I picked nursing.
Okay.
I graduated with my bachelor's in nursing. I worked as a nurse for several years, and I started having chronic headaches, and it was primarily because the repetitive hitting people in college football. And I went to an orthopedic surgeon. He told me we should do a spinal fusion. And I was like, absolutely not. I'm not doing that. So I just saw a chiropractor, and I'd have to go to a chiropractor every 1 to 2 weeks, and that would keep me out of pain. And then I stumbled across this physician, and it was through my girlfriend at the time, now wife. And I went to him, and he said, listen, I think you can keep going to the chiropractor, you can keep doing all that, but I really think you're a candidate for regenerative injections. So I was like, fine, what do I got to lose? That's kind of the way I looked at it. I didn't know anything about it. I'd already been in medicine almost like close to 10 years by that time. And so I did it, and I was pain-free for 3 months. So I was like, all right, this is what I want to learn to do. And I found the best way with the best training to be able to do that was actually naturopathic medicine. It wasn't the quickest way, but it was the best education. And so I did that. And then when I got into my residency, I was doing a ton of it, and I noticed that like there was a certain group of people I injected for whatever they had going pain relief wise and functionality, and they would get better. And there was another group I would inject the same injection and they wouldn't get better. So I was like, why? So then we started drawing lab work, and we saw that basically the people who were getting better off the injections, their hormones were dialed in, and the people who weren't were not getting better. They just didn't have all the building blocks to basically allow their body to regenerate. Even I'm doing the same awesome injection. It didn't change a thing.
That's very interesting.
So that's what really dove me. I was like, all right, I have to learn hormones because, and again, I'm very interested in regenerative injections, but I was like, I need to do this in order to get my patients better. And if they're not optimized, I won't even, like I have people who will come in and they want to do like stem cell type stuff, like high-end ticket stuff, and I'm like, we have to check your hormones first, because if your hormones are off, you're going to spend all this money and it's not going to work.
So absolutely. And I think that's a big part of why we're here today.
Yeah.
Is even just with so many of our clients at Fit Body Boot Camp, that have come in, they've tried everything, nutrition and exercise, and are stuck. And you've been able to help a lot of people in really those underlying hormonal issues.
Absolutely.
And so, I think even with that, like that's such, it's an awesome story. But even with that, how did you then make that jump to now you have your own clinic,
Right.
Restore Health. And what was the story? How did you get started? Like from that, you graduate from medical school, and what was the path from there of starting up your clinic?
So we started up our clinic. There was a group of us that we went in together. We were all like-minded, and really, when it come to it, for me was I'm older, and so by the time I actually graduated from medical school, I was already in my 40s, and I could already feel the drag because like medical school is rough. It's even rough when you're older and have kids and all that kind of stuff.
I bet.
So my personal story is when I looked at my hormones too, because seeing people that I would inject and then they wouldn't get better, and I'm like, wait, where am I? Because I am way too tired, and dependent on way too much caffeine in order to, I need to be looking at myself, make my own self healthy. So when I looked at my hormones and I was like, oh, you know what I mean? Like, all right. So I was able to dial in my hormones, which then really pushed our clinic to focus on a lot of optimization of hormones. And it's not just about throwing testosterone out there, which is what a lot of clinics do. There's a lot of testosterone clinics, and I say they're testosterone clinics because what they're doing is they're just giving testosterone.
That is a super big problem in the industry, and so yeah, I definitely let's hit on that here in a little bit more because
Okay.
I think that we definitely go deeper.
Do you want me to talk about it right now?
Yeah, sure. You know what?
Okay.
Hey, let's do it. I didn't want to interrupt your path, but let's
Okay.
you know what? Let's go into that. Like, yeah, especially what do you see that's very common within the just the medical community when it comes to testosterone, TRT as it's called, or testosterone replacement therapy amongst regular medical doctors and the recommendations. And what have you seen that's a common practice, and why do you think is maybe not the right way?
So there's two sides.
Yeah.
There's the one side where testosterone, one side that basically what they're doing is testosterone fix everything, and then the other side that I see is you're in the normal range. So I've literally had 20-year-old men come to me, and the general range for testosterone is like 250 to 1,000. Everybody has a little bit different scale that moves around. I've had people, 20-year-old men, come in, their testosterone's 300. They went to their doctor and they were told, now they have all the symptoms, you know what I mean? Fatigue, erectile dysfunction, low libido, everything. And the doctor's like, oh, you're in the normal range. And they just like, you're okay. And they're like, I don't feel okay. And they're so young. To the other end of the spectrum is people come in and they're, high-end athletes, or they're entrepreneurs, or they have just stressful jobs and everything. And they're like, oh, here's testosterone. And they just give them testosterone. And they just keep going up higher and higher and higher. And they have people on like 400 milligrams of testosterone in a week. And all they're looking at is testosterone and maybe also estrogen. And they're not looking at all the other hormones that really come into play. And maybe there's something more going on. But they just keep pushing on testosterone. And that's where a lot of the testosterone replacement therapy gets into the bad area where people are like, it's bad, it causes all this. It does whenever you're cranking out huge amounts of testosterone. And we're even seeing, we had a conversation about this before, we're seeing anastrozole being misused.
Now, so everyone knows, what's anastrozole?
Anastrozole, I'm going to say it non-medically. Anastrozole stops testosterone converting over to estrogen. Okay? And basically what it does, though, is the dose that's mainstream out there that you get from a traditional pharmacy. I'm not going to say any names, any pharmacy, because I don't. But nothing bad about them. But this is what you get that's made from a drug company. Everything is a 1 milligram dose. So that 1 milligram dose was created for women who have breast cancer, to stop them from converting to estrogen, to knock out the breast cancer.
Very interesting.
Okay.
Yep.
So what it also does is it creates a estrogen equivalent that of a woman who's postmenopausal. Well, what happens to postmenopausal women is they start to lose bone, right?
Mm-hmm. Yeah.
So now what they're doing, because it's the easiest way to prescribe it, it's the cheapest way to prescribe it, is they're giving men who are on testosterone anastrozole, which blocks out testosterone really, really well for 48 hours, roughly.
Testosterone or estrogen?
I'm sorry, blocks out the estrogen.
Estrogen,
Sorry,
gotcha.
it blocks the testosterone converting to estrogen.
Okay.
Thanks. Yeah, should have said that all together. So it blocks the testosterone converting to estrogen really well for about 2 days, okay? But the thing is generally when you're dosing your testosterone, you want it to stay relatively constant throughout, all week, and depending on your dosing and stuff like that. So if it's blocking it really well for 2 days, that means after 2 days, it's going really high. Now some doctors will have them take twice a week. That means 4 days out of 7, you're blocking it well. There's better ways. You can microdose it, do it smaller, utilize compounding pharmacies, things like that. And it's just that a lot of the medicine out there, and the doctors are practicing the medicine that they learned in medical school.
So talk about that for a little bit, because you say from medical school, and why do you think that that is a problem?
So medicine is constantly changing. I don't know the exact time from the time that something has come from an idea to the time it makes it into an actual book, but I can tell you if something's moving really fast from the time research comes out to the time that it's actually put in a peer-reviewed paper, and that's fast, is like a year. So for like a book, you're probably talking like 5, 10 plus years that information was actually developed, and by the time it gets in a book, there's already new ways of doing it. I mean, I have people who come into me injecting testosterone every 2 weeks. And I'm like, it's like your second week's horrible, huh? And they're like, yeah.
Yeah, but talk about that, because again, this is one of those examples amongst testosterone clinics or even just doctors that, as you're talking about, they're slinging testosterone. Why is doing a strategy like that of once every 2 weeks or even once a week, which is a very common practice, why is that a problem?
So everybody's a little bit different. Everybody metabolizes a little bit different. Different types of testosterone get metabolized differently, quicker, slower. You'll have one person that, let's say a cypionate, will stay in their system for 5 days. The next person, it's 1 day. You know what I mean? So you don't know until you know type of thing. And for most people though, a cypionate, testosterone cypionate, will not stay past 7 days. So if you're injecting every 2 weeks, that testosterone that you injected, there's nothing there. Now, if you're injecting once a week, you are probably, some people might get by with it, but I would say most people always say by the end of the week, they drop off. I would say about 90% of the people say by the end of the week they drop off. Now, what happens though is our testosterone is produced daily, and then it gradually goes away by nightfall, and then it's like this rhythm, okay?
Yep.
So the more you can duplicate that rhythm that your body naturally does it, the better you're going to feel. Now, this goes to microdosing and things like that. Some people don't like needles.
Yep.
Some people don't like to inject every day. Some people. So what I do with people is I find out where they're at, because the best treatment is the one that people will do.
Absolutely.
So do I have some people injecting weekly? Yes, because they hate needles and they can only get it done on Sunday, type of thing. Do I have people injecting every day? Yes, because they don't care about getting stuck and they just want to feel, they're so fed up with wherever they were at, they just want to feel better. And what I find though, this is the cool thing, okay? The cool thing is whenever you do that micro dose, you actually do a smaller dose.
Very interesting, yes.
So I can have somebody taking 10 milligrams of testosterone every day from 5 to 7 days a week, doing 50 to 70 milligrams of testosterone, and get them at the same testosterone level as them taking 200, 300, 400 milligrams of testosterone.
Yeah, and this is the thing, and just so everyone knows, this was kind of the big game changer for me, because we came in and started off with this idea of using creams.
Right.
But, just it wasn't really,
some people don't absorb it well.
Yeah, and I think I was
Guys usually don't like it either.
Yeah.
Women are used to putting creams on their body, and then when you tell a guy to put cream on their body, they look at you like,
yeah. But I mean, that was the thing. I had tried pellets. I had even been at another well-known men's testosterone replacement clinic that they had me doing 360 milligrams of testosterone.
That's a lot of testosterone.
And it only got my total testosterone levels to about 700. And I remember even the physician there saying, like, dude, you're like one of the top metabolizers, top 4 people in here. You know, and then I also started feeling the side effects of that. You know, they started having me on anti-estrogens, and it's just because you're getting this huge shot.
Right.
Whereas now, I think that's been one of the things that's been a complete game changer. And I think really for so many people, what you're doing is that there's almost no doctors to recommend daily micro dosing.
Right.
And I think that's something. So switching to that, it's my levels have been higher than they've ever been. I'm literally on a quarter of the dose that I was before, and it's not having any of the side effects. I mean, I truly feel amazing. I mean, that's kind of the foundation of a big part of where this program is coming from. It's beyond, you know, if you have to go on to the TRT, you know, what's the best way of doing that? But, you know, I think even beyond that, like, what have been some of the other common things you've seen with some of the men that you've been working with that have, you know, maybe that are some signs and symptoms that their hormones are off, and what are, before having to go on to doing testosterone replacement, what are some other things that you typically will take people do, or recommendations before going down that route?
Well, before anyone does testosterone replacement therapy, the first thing they need to do is look at their diet, okay?
Absolutely.
I work a lot with athletes and I work a lot with entrepreneurs, and the thing is the commonality between the two is they generally know how to work or train really well, but they don't know how to recover well. So what's their sleep like? You know, what are they putting in their body? Yeah, you can crank out all this hours, make all this money, you can train, you know what I mean? Like they're very similar. Entrepreneurs and athletes are very similar. Entrepreneurs don't have an off season. So they're like at 2 a.m. they're still an entrepreneur, you know what I mean,
Yeah,
type of thing.
absolutely.
So you see these low testosterone in a lot of entrepreneurs. But getting back to what I'm sorry, I started to get off topic.
Yeah, no, just like, what are some of the things
Oh.
that is a new patient comes in to see you?
Oh, yeah,
You
yeah.
know, like, what are some of the first signs and symptoms of that their testosterone is off or hormones are off? And then before going on to testosterone replacement, what's you know, what's kind of the procedure? What are the other things you look at before having to go on to TRT?
Yeah, so I'm saying diet, sleep. And here's the thing, like, are you giving your body the building blocks that actually allow it to create testosterone? If a patient is on a statin drug, which is a time and place for statin drugs. Statin drugs decrease cholesterol. Cholesterol turns into pregnenolone. Pregnenolone can then turn into, and it goes downstream, can turn into testosterone. If you knock out your cholesterol, you don't have the initial building blocks to create testosterone or any of your fat soluble hormones. So you have to be very mindful of that. So you need to look and see where they're starting, clean up the diet, get them sleeping, get them recovering, and then proper supplementation. Unfortunately, in this day and age, our food has become less nutrient dense. High in calories, low in nutrients is kind of what's happened with our food.
Yes.
So, you know, 20 years ago, yeah, we didn't probably need to take a multivitamin and all this different things, but now we really do. Just because eating your, you know, a tomato today versus a tomato 20 years ago is totally different.
Absolutely.
So yeah, so addressing diet, addressing you know, those basic building blocks first, getting some lab work to see where they're at, and then the most common symptom that I hear is, and there's another stuff that can go with it, but the most common symptom is this, like, I just feel blah. Like, if you said I could just sit on the couch and you hand me the remote and I'll just sit there, I would be totally cool with that. Wife comes out like, hey, and they're like, cool. You know what I mean? Like,
they've lost that drive, passion, and
Right.
just don't really want to do anything.
right. That's the number one symptom that I see the most is a blah feeling. It's usually the first one that comes up. You usually see that before you see any type of erectile dysfunction, before you see, you know, decrease in libido and stuff like that. Another thing that I'll hear guys say is like, I'm going in the gym and like I'm lifting 5-6 days a week and I just can't put on muscle mass. You know, and these are,
Absolutely.
the reason why I'm talking about these symptoms is because they're the non-obvious one. If you can't get an erection, yes, your hormones probably are off.
Yep.
Okay? And guys get that one because they, you know what I mean? If your libido's down, yes. But
You know,
like,
even talking about that, because, you know, the thing that I find very interesting with a lot of these, especially there's Viagra and Cialis, but, you know, is that treating a symptom when the underlying cause is really, it's just a low testosterone?
right. So when it comes to like erectile dysfunction, there's three key players. There's blood flow, there's the hormones, and there's the nerves. So you can address the Viagra just taking, maybe I shouldn't, taking a medication that it helps you get an erection. Edit that part out. We don't want to say any names or anything. But taking a medication that will make you have an erection, you're not addressing the problem, like you're saying. So it could be a nerve issue. So you can do, there's actually an injection therapy that resets the nerves to the area. But if it's a blood flow or a hormone issue, the hormones can help with the blood flow, and of course then the hormones themselves will help too. So, and if it's a blood flow and you're just taking Viagra to cover it up, then you're cruising for a heart attack.
Yeah.
So that's why, hey, I'm not against people utilizing those things, but what's your cholesterol? What's your cardiac risk? You know, having low testosterone and low estrogen increases your cardiac risk.
Yeah. You know, and this is something else that's also very interesting because, you know, a lot of people, there's this perception in society that, like, you know, for example, if women, if their hormones are off, you work with a lot of women and you'll prescribe, you know, just a lot of different things, whether it's estrogen, progesterone, even testosterone for women. But yet if men are having to take testosterone, there's this stigma like, oh, you're taking steroids.
Right.
And, you know, I just think, when you kind of think about it from that perspective of, like, well, first, I mean, what would you say to anyone that's thinking, like, maybe they're stuck, they're feeling these symptoms, and they're like, yeah, but I don't want to have to do this. What do you consider the difference between steroids and TRT?
So here's the thing. There are steroids that you can do to get all everything, you know. But TRT, and we're talking about testosterone, is kind of the backbone hormone that, especially for men, okay? Women need it too. Women need it too. There's a lot of medical doctors that are like, oh, you know, it's like, no. But for men, when you don't have a optimal range for you, you will not literally be yourself. And that's the biggest thing that I see, that people, once they get in that optimal range, they literally start acting like themselves again. So my goal whenever someone comes in there is, and people always ask me like, what number are you gonna get me to? I'm like, it's not about the number, okay? It's about how you feel, and then when you feel awesome and we draw, and then that's your number. Your number is where you feel good. Now we're not trying to make you some bodybuilder or something like that. It's about, obviously it's about being fit, but it's not about, you know, being up on the stage like type of thing.
You know, and I think that's the thing, even with that, is that, you know, with this perception that a bodybuilder, especially you look at that, like they're taking ridiculous amounts of just testosterone, all sorts of, it's a cocktail of
it's not
drugs.
just testosterone. They're taking a variety of different steroids that do different things, and it's doing it the way that they're doing it, hey, whatever they want to do, that's fine. What you'll find is a lot of people who stay in that sport and who are doing the different steroids, they usually end up having heart issues at some point because it has an impact on the heart. And that's not the concept that you really want to do with any type of testosterone replacement therapy.
Well, and I think that's the big perception, though, is that there's a stigma, because people are looking and hearing about that, okay, well, all steroids or any type of form of testosterone, that must be steroids, right? And you hear about these issues that bodybuilders have, but, you know, why is that not the case if you're doing therapeutic testosterone replacement?
So, number one, testosterone is a natural anti-inflammatory, okay? So, if you don't have an adequate amount, and this happens a lot. So like a lot of people see me for pain. You know, they come into me for pain. I'm like, all right, let's check your hormones first. And they come in and they have this pain and their shoulder and this, and I optimize their hormones and they come back and they're like, my pain's gone.
Very interesting.
You know what I mean? And I'm like, okay, well, I worked myself out of work, but I'm okay with that because they're in a better place.
Absolutely.
So like when testosterone is also needed to regenerate. So literally, I had a guy who tore his quad. You could see the quad retracted. It wasn't complete tear.
All right.
You could see his VMO, vastus medialis oblique, retracted, okay? Now, we did stem cell therapy and all that kind of stuff, but we also had him on hormones and we did topical testosterone. We have it tracked where his quad reattached.
Wow, that's pretty incredible.
It is. Like it, and I even told him, I said, listen, traditional science says you should reattach that with surgery. He didn't want to go to surgery because he said, my dad died underneath anesthesia. I'm not going to surgery. He was like, let's do stem cell and get my hormones right. And we were like, okay. We did it, and it worked. You know what I mean? So I was like, but it was just about having, and that's this, the regenerative, I mean, obviously the stem cell helped too, but the regenerative effect of the local testosterone plus systemic, body-wide testosterone, systemic, it has such a huge, profound benefit to healing that most people don't realize that it literally is your ability to regenerate if you don't have adequate testosterone.
Yeah, absolutely. And I think just, there's so many things, like I see this because this has been part of my journey and some of these things that I've gone through, and even you have that feeling of blah, or even like, as you say, or anxiety and depression.
Yep.
That is another thing I see that's super big, unfortunately, in the veteran community is veterans have PTSD or depression or anxiety, and that there's a lot of things that happen that we're exposed to, especially OIF, veterans or deployed to Iraq or Afghanistan, and that it's of like especially anxiety, depression that is being treated with some sort of anxiety drug, or instead of, so again it's almost like treating
and a lot
the
of those drugs actually end up decreasing your testosterone too.
Okay.
So not only are and this happens a lot. So when I see veterans, the commonality that I see is all over the board low testosterone. And the challenge is, number one, there's exposure. We don't 100% understand all the exposure and everything like that, but there is exposure.
But talk to that for a minute, just really that you work with a lot of veterans.
Right.
You're saying this is across the board.
Across the board, the veterans, and usually they're younger, and they come in and it's like testosterone is always usually in the lower 1/3 of that range of 250 to 1,000 with veterans. And again, there's a number of different variabilities that could have caused it. Like I said, there's exposure that we don't 100% understand, but more and more information is coming out on it. There is being in a state whenever you're deployed in an area where you could be shot and killed at any time makes your cortisol like on point. Most people don't have a job. Police officers do, but most people don't have a job that when they're going to take the garbage out, they could get shot. You know what I mean?
Yeah.
So there's a certain level of stress, not just using that as an example, but there's a certain level of stress that they're constantly under. And cortisol is part of your fight or flight. So they're constantly in this fight or flight for their entire deployment. And that will pull and decrease their natural testosterone. Well, that's how the body's supposed to work. When the tiger or lion walks in the room, you're supposed to either attack it or run from it. Cortisol is part of that mechanism. But if the tiger never leaves the room, and how long can a deployment be?
I mean, for me, it was a year. For especially, I think Army had the longest. There was some guys that were 15 months and then come back for 6 to 12 months and back over there again. I mean, there's a lot of vets that have 3-4 deployments.
Yeah. So to be in a state for a year straight where you're literally fighting a tiger or running from it is not natural. Okay? And it will deplete your testosterone. And actually what you're teaching your body over time is to not shunt towards testosterone. So by the time that these guys and women come back from overseas, their testosterone is shot. Plus the exposure, plus the potential trauma that could happen. And there's so many variables. PTSD, again, PTSD means you're still in the cortisol. You're still being on the cortisol. And if you went overseas, the chances of you having that is even higher.
But you hit on that because that's a very interesting thing. You see veteran suicide rates, PTSD.
Yeah.
I mean, how do hormones tie into that?
So what I tell people is that hormones touch everything. And there's a big hormone that is ignored a lot is actually progesterone,
okay,
especially in men. Progesterone, they found, is a natural anti-inflammatory to the brain. Okay?
Very interesting.
Right, okay? So and this is a side story. This is about a guy who came to see me about trembling hand. He had a tremor. He'd been to 3 different neurologists, CTs, MRIs, Everything came back negative, and I said, "Why did you come and see me?" He said, "Because you have a good Google review." And I was like, "I do hormones, you know? I'm like, I do hormones. I don't know what to tell you." And he said, "I said, listen, I'm going to check your hormones. If something's off, we'll do something. If not, I'm sorry. It's not. I'm not a neurologist. You know? Checked his hormones. He had no progesterone. I put him on 10 milligrams of progesterone. Wrote for 10 days. I said, listen, if it makes your tremor go away or makes it less, I'll keep you on it. If not, I'm sorry, you know." On day 8, he's blowing up my my office number, like, "Hey, I'm not coming off. My tremor went away." So, like I said, it literally knocked out the inflammation in his brain, and his tremor went away.
Okay, that's so interesting.
Yeah.
But you know, you don't ever hear about this in the regular medical community.
No.
And especially hormones. And I think even coming back to this with a lot of the veterans that you've worked with, and just, you know, with what you can share without violating any, you know, HIPAA stuff, but like, what have been some of the biggest things you've seen with veterans coming in of issues?
So,
and I think even further, like, this has been the big thing. I think my frustration was coming from the VA that was just in some ways giving horrible advice. And kind of was led
it's a
me
numbers
to.
game. They're, you know what I mean? Like they have the medicine that they're practicing is very similar to traditional medicine, where, you know, they get paid off of how many patients they see, not off of results. And that's very traditional medicine. It doesn't matter if they get you better or not. They have to see X amount of patients a day. They see X amount of patients a day. They met their quota. Okay? So that's very common and across the board, not just VA. And the VA is very, like, they're trying to take care of a lot of people. They probably need more doctors is what they really need, you know. But that's a different animal.
Yeah.
What I see, what was the question again?
Especially for veterans. Like,
Right, what I see commonly with veterans, number one is low testosterone. Their cortisol is either totally absent, because like I worked in the ICU, so like I've seen cortisol levels like that are like 2. You know what I mean? Like we're like, it's pretty similar to a cortisol level that I would see in the intensive care unit. And they're walking around just being people, and I'm like, I don't know how you're walking around, man. You know what I mean? So their cortisol level is completely gone. And then another thing we see is progesterone is off, because progesterone also helps with concussions.
Interesting.
Think about how many times, you know, that's why I always say to guys, like, have you ever taken a shot to the head and not, you know, but like a hit or anything like that? And most people, when they look back throughout their life, they're like, well, yeah. And you're like, you got your bell rung? You know what I mean? That's, you know what I mean? Like, yeah. And you're like, that was a concussion. And they can stick around for a long, long, long time and cause issues. Progesterone helps beautifully with that. So seeing their progesterone off, seeing their cortisol off, seeing testosterone off, seeing their estrogen off, which a lot of guys don't pay attention to estrogen. They always want to keep it low. But the thing is having low estrogen or too much estrogen. Low estrogen gives you a very flat effect. I call it the psychopath. Like actually having no estrogen is more psychopath, okay? Having too much estrogen is when you're watching the kitten commercial and you're starting to cry a little bit. So I see both, because their bodies have, you know, gone through so much stress, have been exposed to so many different types of things that usually they're not producing testosterone well. Their receptor sites are blocked. So even if they did have it immediately, they wouldn't necessarily even, help them.
Absolutely.
So that's, I would say, most common. That's what I see. And of course, they're, for the most part, depressed at some level. So.
Yeah, and I think, honestly, we could spend so much time on this.
Yeah.
And, I look forward to having you back on future episodes to be able to talk through a lot of these things and deep diving into it. I would say just kind of like, as we're wrapping up, just maybe a final thought, like, of if somebody, what are they feeling that, like, is a sign that they need to get something checked out? Like, what's that thing? If you're going to say there's one thing, like you're experiencing this in your life, or maybe a few things, like you need to get your hormones checked.
So here's the thing. This happens especially with men, okay? Our hormones diminish over time. It's how you cook a frog, right? You slowly turn up the heat. So what happens is all of a sudden you're just literally, and I said it a little bit, you're literally sitting on the couch and you don't care. And if you start to feel like you don't care, something's off. Get your labs checked, see where you're at, be aggressive about it, because the longer you wait, the more likely you are going to require more to get you back to where you're at.
Okay, that's super helpful. I can tell from experience of just knowing that before I got everything for myself figured out, that in a lot of ways was very true.
Right.
So I think we got a couple last just fun questions here. First, what is just a fun random fact about you that most people don't know?
So I train jiu-jitsu.
Okay.
I compete in jiu-jitsu. Sometimes I win, sometimes I lose. I've been doing it for some years now. In fact, that's why I have this black eye.
Oh, it wasn't your wife?
Wasn't my wife.
Okay,
I was doing it, training jiu-jitsu. I love it. It's one of the things that keeps me active. I'm 49 years old and I'm still competing. I roll around doing jiu-jitsu with guys that are in their 20s, and I give them a run for their money. So that's just part of keeping my hormones optimized, and sport that I truly love.
Absolutely.
So.
And you're a living testimony to the hormone optimization, because you don't look like you're less than a year out from 50, and obviously with everything that you do and a combat sport and being able to dominate and compete at a pretty high level from that's a pretty awesome thing. So I think the last question, obviously you're working in your passion. You get to do something that you love every single day. And I think just one of the questions I like to ask all of our guests is, at the end of your life, what is the legacy that you want to leave?
So one of the things that I'm actually taking more of a turn on right now is I am wanting to start to educate more, because I can only treat so many patients, and I want to educate more doctors on how to really optimize people's health, because to me, it's not about how many years I live, it's about how many quality years I live. And we need to change medicine. Medicine needs to be focusing on quality of life and not just, here's your pill, keep going type of thing.
Absolutely.
So,
now, that is so impactful. I mean, I know that just working with you, it's had a huge impact with my life, and I know for the clients that you've been working with, and I know just especially with the program that we're getting going here for the Optimized Man program.
I'm looking forward to it.
And guys, I think this is just something that's, for those of you that don't know, this has just been something coming out of just all the clients that we've worked with, and really research that I've done is going to school for nutrition, and just how can we take people through this process of training, nutrition, being able to optimize hormones first naturally, and then what is the right way to do hormone replacement therapy if it's actually needed. And I think that's the thing that's super exciting, is that really that's where this has come from, is that nobody else that we know of is really doing a program like this, and for the men that have already gone through it, has had an incredible impact. So anyways, if you're watching this, just stay tuned, and it's going to be some exciting stuff. So anyways, I think last question is, where can people find you? If they want to come in and see you, what's the best way for them to get an appointment set up or contact your clinic?
Best way is to call our office.
Okay. What about your social media? What would be the best way for people to find you?
The only social media that I really get on right now is Instagram.
Okay.
Dr. Neil Morris, Neilmorris.
Okay.
DR, not spelled out doctor. That's the main one that I get on. I don't really get on Facebook. I share posts from Instagram to Facebook, but I don't really get on it.
Okay.
I'm just busy. We're out of Mesa, Arizona directly. The phone number off the top of my head, I don't remember.
It's all right. Hey, everyone, just follow him on Instagram.
Yeah.
And you'll be able to see a link to his clinic. And I think one of the biggest things is just guys, if you, especially men, I think the big thing for you to think about with this is, you don't have to suffer in silence. I think that's, if you've lost that zest for life, that's not normal. And you know what? I can just say and encourage you that, we'll be doing a lot more episodes to deep dive into some of these specific clinical items. But I think first and foremost, Dr. Morris, thank you for being on the show.
Thank you for having me.
I know this is going to help a lot of people. And so I think for everyone, if you're listening to this and you found value with this, or maybe you know someone that's struggling with some of these things, make sure to post your comments, and give this a share. Send it out, because This is a message that is not out in the world, and that's why the big way we're doing this podcast is to get this message out, to be able to help a lot of people, and especially as men, you know, to not suffer in silence. You know, and that is the thing. If you can regain your life, which really, this is a huge thing that I'm sure you could testify to, that the men that you've been able to help, it has been a complete game changer in their life.
Absolutely.
Right? So anyways, guys, that's all for the show today. Thank you for watching. And again, we will talk to you soon.